How to administer a glucagen injection.
If the person is being extremely difficult and refusing sugar orally, or is unconscious or fitting. If in doubt, call 999 prior to administering glucagen. Along with insulin, the pancreas also produces glucagon. While insulin stores glucose in cells and causes blood glucose to fall, glucagon releases glucose from the body's stores and so increases blood glucose. It can be given to treat a severe hypo. Glucagen is the name given to emergency glucagon, which can be given as an injection in the home. It comes in an easy-to-use kit and should be stored in the fridge. It's important to regularly check the expiry date of glucagen kits to ensure you always have an in-date kit for use. Inside the kit, there's an instruction leaflet. Try to read through this prior to needing to use the glucagen. Treatment of a severe hypo. Put the person having a hypo in the recovery position and check the time. Prepare the glucagen injection as shown in the lid of the kit. Remove the cap and inject the water into the bottle. Keeping the needle in the bottle, shake it gently to mix the powder and water. Draw back the solution into the syringe. It's important to remove any air bubbles. So hold the syringe with the needle pointing upwards, tap the side of the bottle gently and slowly push the plunger. So there are no air bubbles left and a drop of solution appears at the top of the syringe. You should now have 1 ml of glucagen to be injected. It's important to remember that you cannot harm someone by giving them glucagen, but try to give them the recommended dose. So for a child under 8, 0.5 mils, and for a child over 8 or an adult, 1 ml. In an emergency, inject glucagen directly into the front of the thigh and count to 3 after injecting before removing the needle. The person should start to recover soon, but if they are still unresponsive and uncooperative, after 10 minutes, call 999. Remain with the person and talk to them to help them stay aware and conscious. Once the person is able to sit, give them half a cup of Lucozade and check their blood glucose. If the person tolerates the Lucozade and Glucogel, wait 5 to 10 minutes and give them solid foods such as digestive biscuits or a wholemeal sandwich. This allows the Lucozade to be absorbed and helps the blood glucose continue to rise. As a carer, have you ever had to administer glucagen?
Once we were very close to it, we did have to call 999 in the middle of the night. His big sister to call 999 because his dad was away and he was actually fitting and obviously clenching his teeth, so we couldn't get anything into him. And we were very close to doing it, but we couldn't actually get it into him. So one close shave, yeah.
Yeah, we've read all the instructions, and what we do is when it actually expires and goes out of date, we'll all have a wee shot at it, so we actually have a wee practice and we know what we're doing with it, yes.
After a hypo, the person may have a headache, feel nauseated or want to sleep. This is normal. But it's important to continue to check their blood glucose every 30 minutes for the next 2 to 3 hours.